Hello dear friends, this is a case of a 64-year-old male patient who presented acutely with a new onset bilateral low limbs weakness and urine incontinence. MRI scan was done. Additionally, a CT scan was done, and I will show the images a little later. But let's start with the T2 sagittal, and let's see and discuss the findings. First of all, as you can see, there is a significant deformity and loss of height of the T2 vertebral body with anterior wedge deformity. There is retropulsion. There is significant spinal canal stenosis. There is this collection, an epidural collection abscess, and due to the significant impingement, as you can see, there is a focal abnormal signal intensity of the spinal cord. The signal intensity of the intervertebral disc at the level T2, T3 is significantly high, and there are also some paravertebral soft tissues infiltrations and thickening. Here in transverse images, the upper thoracic spine, let's go down. Here is a normal appearance of the spinal cord, normal width of the spinal canal and the foramina. Let's go a little further down, and here is the level of the pathology, and as you can see, exactly here is the collection, the abscess, the epidural abscess. As you can see, the spinal cord is significantly compressed, and it shows pathological signal intensity, edema, we can see also the pathological appearance of the paravertebral soft tissues, comparing to the other levels which are normal. The collection here once again. It is really very interesting and unusual case. This is the T1 sagittal. We can see the deformity and the loss of height and the anterior wedge deformity of the T2 vertebral body, and pathological signal intensity in T2 and T3 vertebra. Low signal here. The possibility of underlying malignancy, which is complicated or infected, should be considered. So further evaluation should be done, but however, probably this is a case of spondylodiscitis. This is the stir sequence in sagittal. We can see that there is bone marrow edema. We can see the edematous appearance of the intervertebral disc and edema in the paravertebral soft tissues. And of course the collection. the retropulsion, the spinal canal stenosis, and the impingement to the spinal cord. We can also see that there is bilateral foraminal stenosis at the level T2, T3, comparing to this foramina here. This is stenotic. And let's go to the other side. Again, stenosis. This MRI was an enhanced study. Now let's see the CT scan. This is the MPR image in sagittal view, and we can see the T2 vertebra, and the T3, the collapse, the deformity, particularly in the lower end plate. There is some inhomogeneous hyperdensity of the T3 vertebral body, erosions as well in the upper end plate of it, the retropulsion, the spinal canal stenosis. We're gonna see the soft tissues images after a while, but let's see in bone algorithm first. We can see again the foraminal stenosis, it looks that the appearances is a result of a pathological insufficient fracture in combination with the underlying erosions. CT scan in transverse plane with IV contrast. So this is the level of the pathology. We can see the erosions, but mainly we can see the pathological surrounding paravertebral soft tissues with a degree of enhancement. So let's start from the upper level and let's scroll the images down so you'll have your impression. Just keep in mind the previous images and compare with this. I will show you these images, the soft tissues images in sagittal view as well. T2 and T3. We can see again the deformity, the collapse of the T2 vertebral body, the retropulsion, the spinal canal stenosis. Probably we can see the collection at this level, but anyway it's very ill defined in the CT scan, but anyway it's good to know. You can see here, this is the site of the collection. It's good to have the MRI images and correlate to each other, and otherwise it's very difficult to identify this abnormality, if you agree. Let's go back to the MRI and see the T2 turbospin echo sequences in sagittal and transverse plane side by side, and let's see the abnormality here, the collection, the abscess, the spinal epidural abscess. Dear friends, thank you for watching this interesting video. If you like my videos, you can consider to subscribe to my channel so you will be notified the next time I will upload the next interesting video to my channel. Thank you very much and see you the next time soon.